Good evening again. It gives me great pleasure to introduce our guest speaker for today. This is a gentleman that is no stranger to the profession of nursing. Actually, is his industry. This gentleman graduated from our last RN program. Yes. Of course, he passed his NCLEX on the first time. He is no stranger to education as well. Actually, he knows that he is a lifelong learner. So he will be doing something for the rest of his life. Currently, he is enrolled and almost completed with his bachelor's degree in nursing. And he just graduated last year this time. And then I understand in the fall, he's enrolling in his doctorate of nursing practice program. That's a round of applause. The speaker has his master's degree in divinity, an MBA, and a master's in education. He has his skills, his talent, his love, his sharing for people, and his ministering to the dying has been done with hospice. And now he's working as a case manager. And it gives me great pleasure to introduce to some and present to others Mr. Stephen King.
Good afternoon, esteemed graduates, educator faculty, family members, and guests. Today marks a significant milestone in your lives as you depart nursing school and prepare to embark on a fulfilling career in healthcare. Congratulations on completing that rigorous program of study, earning your degree. Because I know exactly what you have been through. ATI, shadow health, exams, clinicals, reading, and more reading. As I look out over the crowd, I'm glad to see that they updated the photo the students get. When I got this last year, I thought, what am I supposed to do with this? Oh, I know. No, it's not time for your meds. Get back in your room. I recall the study that went into successfully completing the NCLEX. So don't study today, don't study tomorrow. Monday, start studying for the NCLEX. It is my honor to stand before you today at your pinning ceremony, since this moment marks your official entry into one of the noblest professions in the world, professional nursing. You should be proud of yourselves for the dedication, hard work, and perseverance that you have shown throughout the journey. I'm grateful to be here to speak with you about the importance of nursing and the many opportunities and challenges that lie ahead. Nursing is an honorable profession, one that demands much in the turbulence that is healthcare today. If your goal is to be a successful nurse, I want to share 3 values with you that will make all the difference in your career. I entitled this the 3 C's of nursing: compassion, cooperation, and competence. Let's start with compassion. The word nurse actually comes to us from around the year 1200 from both an Old French and a late Latin term meaning nourishment, like to nurse a child. In the 1500s, the word was adapted to mean caring for the sick. Underneath both usages of that word underlie the same idea: compassion. Compassion is what drives a mother to feed her child. Compassion is what drives a nurse to care for the sick. Compassion is the feeling of sympathy and concern for the sufferings or misfortunes of others with a deep desire to alleviate that suffering. Compassion is a virtue that is often associated with empathy, unselfishness, and kindness. For 2 decades, the Gallup organization has recognized that nurses are the most trusted profession. This mainly stems from the compassion that nurses show to their patients and their families. Always remember why you chose nursing as a profession. Nursing is a calling, and you were drawn to it for a reason. Whether it was a desire to care for others, a passion for science and medicine, or a personal experience that inspired you, hold on to that motivation as you navigate the challenges ahead. Nursing can be a demanding and stressful job, but can also be incredibly rewarding and fulfilling. As Michael J. Fox, the actor, posted this week on his Instagram account in celebration of Nurses Week, when you care enough to do the very best, you are a nurse. At the center of every healthcare interaction is a human being. Never, ever forget that. Your patient isn't that angry guy in room 316 with high blood pressure. Rather, it's Jim or Gabrielle, who is a mother, a father, a grandparent, a son, a daughter, somebody. Nursing is not just about administering meds and performing procedures. It's about connecting with patients on a human level, understanding their fears and concerns, and providing emotional support as well as physical care. Treat every patient as if they were a member of your own family. Listen to their stories, validate their feelings, and advocate for their needs. Their life has been interrupted. They are either broken or they think they're broken. In the words of Rabbi Harold Kushner, do things for people not because of who they are or what they do in return, but because of who you are. Pope Francis stated that being in contact with physicians and family members, in addition to the sick, you become, in hospitals, in healthcare facilities, and in homes, the crossroad of 1,000 relationships, which require attention, competence, and compassion. Before the uniqueness of each situation, indeed, it is never enough to simply follow a protocol, but a constant and tiresome effort of discernment and attention to the individual person is required. All of that makes your profession a veritable mission and makes you experts in humanity. Understanding compassion is a reminder that through this whole process, you must also practice self-care. Nursing is a demanding job, both physically and emotionally. It's essential that you take care of yourself so that you can provide the best possible care for your patients. Make time for activities that bring you joy, whether it's exercise, prayer, meditation, or spending time with loved ones. Find ways to manage your stress and prioritize your mental health. Learn to laugh to balance the daily grind. To sum up compassion, I leave you with this quote: nurses see the world in its most raw, inexplicable, unfair form of reality, and somehow, by the grace of their inherent hope for humanity and unmeasurable depth of courage, still love it. Number 2 is cooperation. Faith Roberts, an amazing nurse speaker with 47 years of nursing experience, says that you should come to work for 3 reasons: your patients, their families, and your coworkers. Nursing is a team sport. You cannot do it alone. You will work with other nurses, physicians, therapists, and support staff to provide comprehensive care to patients. Be a team player. Communicate effectively and support your colleagues. Celebrate the successes and learn from the challenges together. There are many, many benefits to collaboration. First of all, it allows for a more comprehensive approach to patient care. Secondly, collaboration can lead to improved communication and coordination of care. But most importantly, collaboration can help to improve patient safety. I know that all of you are committed to being the best possible care that you can provide for your patients. I encourage you to embrace collaboration and work together with your colleagues to create a positive and productive work environment. Here are some specific tips for collaborating with other healthcare professionals. Be respectful and open-minded. Be willing to share your knowledge and your expertise. Be willing to listen to the perspective of others. Be willing to compromise. But most importantly, be willing to take responsibility for your actions. Some days you won't feel it at all. And you'll be tasked with 100 things to do before lunch, if you get a lunch. In those days, you will need your coworkers. In those days, you will need your coworkers. Be there for them when they need you, and they will be there for you when you need them. No matter what, be an advocate for your patients. As a nurse, you can have a unique perspective on the healthcare system, and you can advocate for your patients' rights and well-being. Speak up when you see something that isn't right. Whether it's a medication error or a breach of patient privacy, be an active participant in your patient's care and work collaboratively with the healthcare team to ensure that they receive the best possible care. To wrap up cooperation, I leave you with a quote from Rosie Williams, a dynamic African-American registered nurse who went to law school after completing her BSN and practices law in Miami. And incidentally, she is currently enrolled in her PhD program in organizational psychology. To do what nobody else will do in a way that nobody else can do, in spite of all we go through, that is what it is to be a nurse. The last value that I'll leave with you is about competence. Competence is the ability to do something successfully or efficiently. It is the combination of knowledge, skills, and experience that allows a person to perform a task or a job effectively. Competence is important in all areas of life, but it is especially important in the healthcare profession. Nurses are responsible for the care of patients, and they need to be competent in a variety of areas, including medical knowledge, clinical skills, communication skills, patient assessment skills, problem-solving skills, teamwork skills, but especially critical thinking skills. Be open to learning and growth. Your education does not end with your pinning ceremony today. Nursing is a constantly evolving field, and you must be committed to lifelong learning to stay current and provide the best possible care for your patients. Seek out opportunities for professional development, whether it's through continuing education courses, attending conferences, reading evidence-based research, or pursuing advanced degrees. Find a mentor. Never stop striving to be the best nurse that you can be, because as soon-to-be Dr. Thompson said, after I graduated from Educare, I immediately enrolled in an RN to BSN program. I have 2 courses left. I will graduate with my BSN in September, and then I start my doctorate in the fall. But you remember ATI and Shadow Health? Guess what? You get to meet them again in your BSN program. Remember, competence is not something that is achieved overnight. It takes time, education, and experience to become competent in a particular area. Listen to this important reminder from Oprah Winfrey. Education is the key to unlocking the world, a passport to the future, and a ticket to success. Here are some additional tips for improving your competence as a nurse. Be proactive. Don't wait for someone to tell you what to do. Take the initiative to learn new things and develop your skills. I have never seen a problem that nurses could not fix. Be self-aware. Be honest with yourself about your strengths and your weaknesses. This will help you focus on areas that you need to improve. Be open to feedback. Don't be afraid to ask for help or feedback from others. This is a great way to learn and grow. But most importantly, be patient. It takes time to develop competence. Don't get discouraged if you don't see results immediately. Just keep working hard, and eventually you will reach your goals. And then when you reach those goals, set some new goals. When you reach those goals, set some more goals. As Dr. William Osler, a Canadian physician and one of the founders of Johns Hopkins University, stated, "The trained nurse has become one of the great blessings of humanity, taking a place beside the physician and the priest." Now, my personal hero in education is my wife, who is sitting right over here. Raise your hand, please. My wife was a registered nurse that wasn't satisfied to just be a registered nurse, but went to medical school and became a physician. So whatever goal you have, you can put out there in front of yourself and make. To sum up competence, I leave you with the words of Mary Eliza Mahoney. And if you don't know who that is, she was the first African-American registered nurse. I believe that education is the key to success in life. It is the key to opening doors and opportunities that would otherwise be closed. Be like Nurse Mahoney. Seek that education. Now, despite all the challenges of today's healthcare environment, I want to emphasize that nursing is an incredibly rewarding profession. Every day, you will have the opportunity to make a positive impact on the lives of your patients and their families. You will have the chance to witness the resilience and strength of the human spirit and to experience the deep satisfaction that comes from helping others in their time of need. As you leave this ceremony today, I encourage you to embrace the many opportunities and challenges that lie ahead. Stay committed to your patients, your profession, and your personal growth and development. Remember that nursing is not just a job, it is a calling. It is the highest calling. And your work as a nurse has the power to transform lives and improve the world. When you go through the door to your workplace, whether working days or nights, in a clinic, a home, or a hospital floor, never forget, you do the most important work because you do the work of human life. In closing, I want to congratulate you once again on this tremendous achievement. You have worked hard. Boy, do I know how hard you worked to reach this moment. And you should be proud of all that you have accomplished. As you embark on the next chapter of your lives, I wish you all the best. I look forward to seeing the many contributions, the advanced degrees, the papers you will publish that will make the field of nursing better than it's ever been in the years to come. Thank you, and God bless you.